on this madrasa business.
Okay, if everyone could start taking their seats, we're going to get started in 10 seconds. Welcome to Panel 1. My name is Michael Kugelman. I'm the South Asia Regional Specialist here at the Woodrow Wilson Center. We're now going to move into some of the key issues and challenges that were touched on very well in the opening presentation. We're going to hear about the economic history in the context of Pakistan's demographic situation. We're going to hear more about family planning, reproductive health, and also, of course, the very vital issue of youth demographics and what that means and the implications. So the format will be that we'll hear from our three speakers, and then after we hear from them, we'll go to a Q&A, but we'll let them all speak first. And we're going to go in from my right to left, so from your left to right. First speaker will be Shahid Javed Burki, who is a senior scholar at the Woodrow Wilson Center and also chairman of the Advisory Council of the Institute of Public Policy in Lahore. He held a number of positions with the World Bank over a long career, including vice president of Latin America and the Caribbean, director of China operations, and director of international relations. And as many of you know, he also served briefly as Pakistan's finance minister and also before that chief economist of the government of West Pakistan. And his publications include a book focusing on Pakistan's economy under the Musharraf period. So I now cede the floor.
Thank you very much, Michael, for inviting me to this important seminar. I'm operating under a bit of a disadvantage. I worked very hard to develop my notes for presentation, and I completely forgot them on my desk. So I'm going to wing it. But before I wing it, I just want to take up a question that was asked from Zeba, and this is the suggestion that madrasas now dominate the education system. And because of this question, I was taken about 2-3 years back when I gave testimony in the U.S. Senate. And at that time, Senator Richard Lugar was in the chair. And when I had finished, he said to me, Mr. Burki, you have 33% of the enrollment in madrasas. And don't you think this is going to create a major problem? So I said to him, I said, Senator, I have seen the report to which you're referring. That 33% is mentioned because people who edited the report misplaced a decimal point. It is 3.3% rather than 33%. Now that 33%, the report was produced by International Crisis Group, and it was looked at by the World Bank, and the World Bank then told me that this is what had happened, that they had just misplaced the decimal point. And that has created an impression that the system is now dominated by madrasas. The latest numbers that I got in Pakistan very recently, I was in Pakistan last week, and these are sort of very rough numbers. Nobody really knows the exact numbers, but that something like 70% of the total enrollment is in public institutions. 60% is in public institutions and declining. 35% is in private institutions. Most of them are for-profit institutions. And 5% is in madrasas. And of these 4% are traditional madrasas. These things have been around for a very long time, decades. And 1% these madrasas that were set up in the 1980s to produce mujahideens and jihadis and so on. So this is roughly the composition of enrollment. I mention these numbers because they are very important for public policy. Public policy in Pakistan has to focus on public education. And that's where 60% of the kids are. And that's where the education that they are receiving is pretty bad. It really does not prepare them for being active participants in the workforce and contributing to the economic development of the country. But this is, I just thought I should give some clarification to the question that was asked. My own presentation, but before I go to my own presentation, there is a point I want to make, and I guess there are more demographers in this room than economists. And so I am, by making the point, taking a bit of a risk. My point is, in the case of Pakistan in particular, there has been a very, very low level of conversation between demographers and economists. The two sides really don't understand one another. And that is, that's a very troubling aspect, because population, the weight of the population of the Pakistani economy is so large, its potential is so tremendous, its ability to do damage is equally large, that there has to be a very, very well-informed conversation between these two groups. And that has been neglected. Listening to Zeba, and I also visited her a few months ago at her center, she is one of the few who's trying to now bring the two sides together and have kind of a relationship. So that's going to be my first point. My first point is, or let me just mention the points and then I'll go over them very briefly. My first point is that we need to put all this discussion about population into some kind of a conceptual framework in which the ultimate objective should be development, economic change, economic growth, betterment of the people, and so on. And in that, population becomes a contributor. That's my way of looking at the situation. Traditionally, what we have seen in Pakistan is a kind of a reactive role. People who are worried about various aspects of population take a look at what's happening to various aspects of the population, and then they react to those. So it is not a proactive stance, it's a reactive stance. Now, in economics, those of you who are economists know that there have been some very significant developments in the last, I would say, 1 decade. Before that, just a minor detour. Before that, economics, particularly development economics, was dominated by people who had come to the conclusion that growth and economic change is the product of the coming together of two factors of production, capital and labor. Arthur Lewis, Robert Solow, Samuelson, and so on and so forth. And then they had a production function in which labor and capital were the two principal contributors, and the end product was income and so on. But in the last 10 years, there are some economists like Robert Lucas of Chicago and Paul Romer of Stanford. They have brought people into the equation. And they have done this by saying that human development and technology are very, very important contributors to economic change. And so the economists, therefore, have moved towards recognizing the importance of population and bringing population as a factor for understanding growth, economic change, distribution of economic product, and so on. So my first point is, and I will just stop over here by saying that we do need a conceptual framework in which the two disciplines begin to work together and just begin to see that how they can relate with one another in order to produce what are common sets of objectives. The second thing that I want to do, Zeba has done that to a limited extent, but I'll probably spend a bit more time on it. This is Pakistan's broad population trends since 1947. And there are some fascinating things about Pakistani population, the way it has developed over the last 60 years. And one of them has had a very, very profound impact on the structure of the Pakistani economy. And that's something that demographers don't normally realize. In fact, economists also, who don't look at demography as a determinant, take much note of it. The second one, or the third thing that I want to say, is how the movement of people in Pakistan has played a role in economic change, in bringing about economic change, economic development, and so forth. It's one of those countries where migration, in-migration, out-migration, migration from villages to towns and cities has had a very profound impact. And this is something that we need to understand in order to build upon the sorts of opportunities that people have now begun to talk about. Then the fourth part is the future of Pakistani population. Some of it is based on the work that the United Nations has done. The United States, as you know, produces a number of variants, low, medium, high. And in my own work, I've been using the medium variant, according to which Zeba was talking about 175 million people. UN says there are 185 million people in Pakistan today. Unfortunately, and that's mostly for political reasons, we are not holding censuses at regular intervals, although Constitution demands that census should be held every 10 years. Pakistan has not been doing that, and that's for political reasons. But if we start talking about that, it will be a bit of a deviation. And finally, I like to talk about how we could turn population into an asset rather than into a burden. It's a theme that I have explored quite a lot in my own work. And like Zeba, I am an optimist. I think there are things that we can do to our population which would make it a substantial contributor to Pakistan's development and Pakistan's economic change. And in this context, I like to point out, and I was very encouraged by one set of numbers that you gave, which is the narrowing of the gap between female and males in enrollment. So more girls are now joining schools. I don't know what the dropouts rates are. And when I go to Pakistan, and now I do that quite frequently, I am amazed at the amount of human development that has occurred amongst women, the skills that they have picked up, the jobs that they have acquired, the things that they are doing in terms of trying to change the society. I have a tremendous hope that if Pakistan is going to develop positively, women would have played a very, very profound role in that. And let me then say a few things about history. I'm conscious of the fact that I'm allowed only about 20 minutes, and I guess I've taken up 10 already. I'm sure you're familiar with the fact that Pakistan's population has grown 6 times from 1947 to the year 2010, from 30 million to 185 million. I was saying that I'm using the United Nations median forecast. You were talking about 175. They say it's 185. Now, six times increase translates into an average increase of 2.92% a year, which makes it one of the, if not the most, one of the most rapidly growing populations in the world. The rate of growth was slow in the beginning. Zeba mentioned about mortality and fertility rates not keeping in line. The rate was relatively slow from about 1950 to around 1970, 75. Then it picked up very rapidly, according to the statistics, and has begun to decline since about 1995. But that decline is not as rapid as has been the case in some other areas. While preparing for this talk, I did two types of what-if analyses. I said to myself, what would have happened if the program that Zeba talked about, Ayub Khan's family planning program, if that had been sustained, and if one half of its objectives have been met, what would be the size of the Pakistani population today? And if you do that, it comes out at about 30 million less than what we are. So it would have been about 155 million rather than 185 million. So that's a missed opportunity because of the way politics developed in this country. The second what-if way of looking at Pakistan's demographic history is to compare Pakistan's performance with that of Bangladesh. Bangladesh has had a remarkable demographic transition, one of the most successful ones in South Asia. And if you use those rates of growth and their fertility rates and their mortality rates and impose those on Pakistan, then I come to a figure of Pakistani population of 142 million. So there is a difference of 43 million between following Pakistani trends or imposing on Pakistan the Bangladeshi trends. And that gives you some notion as to the kind of impact policy can have on the size of the population. Zeba, in her presentation, talked about Bangladesh and talked about admiringly about Bangladesh, and I do the same. She talked about the use of fairly aggressive population programs. When I look at Bangladesh's situation, my own view is that what was really the reason for this rather dramatic development in Bangladesh was the opportunity given to women to get employment in the ready garment industry. There are now millions of women in ready garments industry. They are much better educated than those who are not. They are also more highly paid. They have become independent, relatively independent of their husbands. They are taking decisions about their own family situation, timing of fertility, and so forth. And that has had an amazing impact on the evolution of Bangladesh's population. I tend to look at median rates in order to understand what's happening to our population. Median rate, as you know, is it's the age above and below which there are 50% of the total population. It has seen some improvement in Pakistan. Pakistan has added about a couple of years to its median age, gone from 18.2 to, I believe, 21 or close to 22. Bangladesh, in the same period, has increased by about 6 years. So there has been a relatively more quick, they have done this relatively quickly, and that has resulted in some aging of the population, and that has happened because of women's employment, as simple as that. Now, my third point is about movement of people and why we need to take cognizance of the movement of people, because it's a very important factor in understanding why study of population is so important in order to study the growth of the Pakistani economy and the challenges that Pakistani economy faces. I like to point out that we have 4 very major migrations, immigrations, emigrations in Pakistan's history. The first one was 1947, when 14 million people moved in and out of Pakistan. 8 million people came into Pakistan and 6 million people left Pakistan. When Pakistan took its first census in 1951, 25% of its population was made up of refugees. There has never been any state or society in the world that had such a large proportion of refugees as Pakistan had. A very significant number of these people went to the urban areas. About 1.5 million went to Karachi. Another 500,000 went to some other cities of Sindh. About 1.5 million went to the urban areas of the Punjab. So these 8 million people that came in brought about a quantum jump in Pakistan's urbanization. At the time of independence, only 10% of Pakistan's population was urban, only 3 million people. By the time these people had settled down, that had more than doubled. It is not only increase in the in urban population that was a major element in demographics. These people were urban, they had urban skills, they had urban interests, they were also more educated. So almost overnight, Pakistan switched its economic orientation from being an agricultural economy to becoming an industrial, commercial, and financial economy. And that transition took place over a very short period of time. And it had both positive aspects, it had also negative aspects, but it is an extremely important feature of Pakistan's economic history. This thing also was helped in a way, if help is the right word to use, because some of the initial policies that were adopted by the Indian administration, there was a trade embargo placed by India on Pakistan in 1949, which forced Pakistan to industrialize very quickly. But then Pakistan found out that they had the skills, they had the capital, they had the managerial capacity to go and do a very rapid program of industrialization. The second important movement takes place in a period of about 10, 12 years. This is 1951 to 1962, when about 1.5 million people moved from the northern areas of Pakistan, northern Punjab and the frontier province, to Karachi as construction workers. This changed the look of Karachi, the ethnic composition of Karachi. It made Karachi a much more cosmopolitan, ethnically mixed city. That kind of thing has advantages, disadvantages. We've seen some ethnic violence in Karachi. But I look at this as a kind of a positive feature because so many different people are able to interact with one another within the framework of one particular city. The third big movement of population that took place in Pakistan was from 1975 to 1991, when about 10 million people moved from Pakistan to the Middle East. 15 million people. 10 million people moved over a 15-year period. So the total number of manned work years that were involved was about 150 million. These people sent in a total of about $150 billion as remittances to Pakistan over a period of 15 years. So it averages out at about 10 billion a year. This was a massive transfer of assets from the Middle East to Pakistan, and with it came some things that we are now very familiar with, a certain type of religion, a certain type of social habits, and so on. The fourth important movement in terms of migration is again people leaving the country and settling abroad. Today, Pakistan has three very large diasporas. One is in the United States, the second one is in UK, and the third one is in the Middle East. Now, the United States diaspora is a very interesting one. It is about 1 million strong. It has per capita income which is about 10 to 15% higher than the American per capita income, because these are mostly highly qualified professionals. their total income is about 40% of Pakistan's gross domestic product. Their capital formation has been quite extraordinary. They have, my rough guess is, been able to have asset creation of around $250 to $300 billion, which then produces a constant stream of incomes. When I was at the World Bank, we studied the behavior of diasporas, and we found that every diaspora goes through the same kind of life cycle. It starts with establishing yourself in the new homeland, but providing a little bit of charity to people back home. Second phase comes along when you have established, created some asset base, then you begin to relate to the homeland through organized charities. The third phase is when you begin to invest in the homeland by creating assets in the homeland. And fourth is when you begin to go back. Pakistani diaspora, about 1 million strong, is now in its third phase. Indian diaspora, about 2.5 million, same level of income per capita, is in its fourth phase. You have lots of Indians now going back to India. So this is an important part of population policy as to how to make use of this over the years to come. Very quickly then, talking about the future, we've heard some numbers. I have somewhat more elaborate sets of numbers from the United Nations about what's likely to happen to population. UN is forecasting that for the next 40 years, Pakistan in 2050 will have a population of about 335 million people. It will become the 5th largest country in the world. It will be the 3rd largest in Asia after India and China. India would be the largest. And this will happen despite some decline in the rates of fertility and population growth, but that decline is not as rapid as has been happening in some other countries of the region. But the interesting part, from my perspective, looking at it as an economist, is there is going to be a massive redistribution of this population from the countryside to towns and cities. McKinsey has done a very interesting study on India, and I tried to apply some of that methodology to take a look at Pakistan. And it appears to me that by the year 2050, something like 75% of Pakistan's population will be living in the cities. There will be 2 cities which will have population of 20 million. That's Karachi and Lahore. There will be about 50 cities with population of 1 million or more. Therefore, this is going to be an urban society doing things which urban societies do in terms of producing what urban people are good at, and also then demanding what urban people need in terms of services and so on. There is a mismatch, a tremendous mismatch at this point between what the state is able to do and what the people will be wanting in the next few decades. And that has to be closed, otherwise you will see an enormous amount of resentment building up in the urban areas. I will mention one other thing and then conclude. This is, economists have been working on what they call windows of opportunity, and they have calculated for how long these are open. The World Bank did a study on this, and they did not include Pakistan, but I used the same methodology, and I came up with my own numbers. The World Bank has a window of opportunity for India, for instance, opening up in 1975 and closing in the year 2035, a total of 60 years. Their calculation for Bangladesh is 1975. It opens up and closes at 2025. And using the same methodology, I have determined that because of the slower decline in the rate of fertility, the window opens in 1995 and closes in 2045. So late opening and short duration. Then this raises the issue as to what is it that Pakistan needs to do. And that's where my original thing comes in when I said that develop a conceptual framework within which you want to factor in population. And my view is that a country like Pakistan, highly, very young, with median age at this point of about 21, 22 years, not terribly well educated, but could be educated. India has shown that it can be done, and it can be done very quickly. When we dialogue with the United States, we should not be asking for market access, which is what we have been doing repeatedly, which really means let us sell garments in the United States. That's not the way to go. If you really want to make use of your population, what you should be asking is access in the American institutions for Pakistani kids so that they can acquire the skills that are needed. If you put in 1 million people, Pakistanis, into the IT sector over a 3-year period, that translates into exports of $20 billion a year, which is equal to Pakistan's present exports. So this is the kind of demographic dividend that's available if you take the right kind of economic policies which take full cognizance of how rapidly the population is growing, what is its composition, and what it could do in order to deliver better results to the country to which they belong. So all in all, I don't look at the Pakistani population as a burden. I look at it as an asset, but it has to be properly managed, and it has to be properly managed by intelligent public policy crafted jointly by various disciplines working together. In this particular case, economists and demographers and sociologists and so on. And then the world outside, which wants to help Pakistan at a very critical juncture, should be helping where this population can become an asset. And that's where giving access to the Pakistanis, to American educational institutions, convincing American IT industry and health industry and education industry to invest in Pakistan. These are the sorts of policies that we should be working on in order to take advantage of the demographics for development. Thank you very much.
Thank you very much, and not bad considering you forgot your notes. Very impressive. We are now going to move on to our second presenter, who is Yasmeen Sabi Qazi, Senior Country Advisor for Pakistan with the Packard Foundation. She's based in Karachi. Prior to arriving there, she was the Executive Director of a non-governmental organization, PAVNA, that focuses on reproductive health. She is a medical doctor and a reproductive health expert and has been an active advocate for women's health issues through her work with civil societies for nearly 2 decades. She's also worked closely with donors and international agencies on reproductive health, both in Pakistan and internationally. So she's going to be treating us to a multimedia presentation. But just before that happens, I wanted to invite up Maria Khan of the Population Reference Bureau, who's just going to give a 1-minute explanatory note.
Thank you. This next presentation is a new advocacy tool that was developed under the Engage project, which is implemented by the Population Reference Bureau in collaboration with our local partner in Pakistan, the National Committee for Maternal and Neonatal Health. The Engage project promotes policy dialogue on maternal and reproductive health using new state-of-the-art techniques in graphic design and software, including the new Trendalizer groundbreaking software known as Bubble Graphs, developed by Hans Rosling and the Gapminder Foundation. And in a moment, you'll see the latest presentation focusing on Pakistan. Dr. Yasmeen Qazi, a member of our local task force in Karachi, will be presenting Pakistan on the Move. which underscores the important link between family planning, health, and development, and the many consequences of unplanned pregnancies, including high fertility and unsafely performed abortions.
Loaded? Is it loaded? Where it is? Okay. Yeah, you can. Okay, so here.
You can't see it in front here because of that computer is off.
I'll tip on my toe. Can you see me now? Okay, so let me get to this screen, and while I'm doing this, I would really like to say a big thank you to the Wilson Center and for inviting me here. And I really need help to get this started because I don't know where it is loaded. So if Maria can be here for a second. Okay, thanks. So what I'm going to talk about, as Maria has introduced, but before I even start this presentation, I would like to say that I will be repeating the facts that Zeba has so eloquently eluded this morning, and of course our economist expert Javed Sahib has also said about it, but it's really, like Maria has said, is a advocacy tool that we are using in Pakistan, and this is something that we thought would be very helpful for this audience. Pakistan has seen some remarkable changes over the last few decades. We are healthier with improved child survival. We are better educated with more people going to school. And our economy is growing with a higher national income. So let's take a look at some of this progress that we have made over years. Here is how we are doing better in health and education. In this graph, we can look at changes and trends over time, and we are going to focus specifically on child health and education among women. Here on the left side, we are looking at child mortality, or the number of deaths for children under the age 5 per 1,000 births. The axis goes from 0 to about 200 deaths. And at the bottom axis, we are looking at education among women between ages 15 and 19, the person that have completed primary school. The range is from 0 to 40%. And this bubble here is Pakistan. The year is 1970. In 1970, Pakistan had a child mortality of about 180 deaths per 1,000 births, and about 10% of women had completed primary school. So what does a child death rate of 180 really mean? That means about 18% of children under the age of 5 were dying. Now let's see what happens to child deaths in education in Pakistan over time. And you will see the years flashing by in the background. So now we see child deaths steadily declining as the bubble moves down, and as the bubble moves to the right, education among women is going up. And education among women rises rapidly through the 1980s and 1990s. And when we get to the year 2000, you can see we have made progress. Child deaths in Pakistan decreased from about 18% to about 10%, and at the same time, the percent of women completing primary school has gone up from about 10% to almost 40%. So we have made progress. We are healthier and we are better educated. Pakistan has also seen improvements in its economic growth during this time. Let's take another look at our graph to see these improvements. This time on the left axis we have gross national income per capita or per person, which is adjusted for inflation, and this represents our economic growth ranging from about $0 per person to about $3,000 per person. And GNI is higher than GDP because it includes the gross domestic product as well as income received from outside the country. And on the bottom axis we have time, so as the bubble moves to the right, we are simply moving across time. And here is Pakistan in 1975 when we had a gross national income of about $380 per person. Now let's see how our national income has changed over time. You can see that the bubble is moving up very steadily, which means our gross national income per person is going up. And when we get to 2005, we have made significant progress going from a gross national income of $380 per person to a gross national income of about $2,300 per person. So we have been able to increase our gross national income considerably, which means our economy is growing. However, the gross national income per person only gives us one piece of the larger picture of economic growth. Although the overall national income per person has gone up, when we look at the poverty levels, 3 out of every 5 Pakistanis are living in poverty. That is over half of the country living on less than $2 a day. Such high levels of poverty impact not only the country's economic development but also our national stability as peoples struggle to survive. So how can we make sure that Pakistanis families are better off and that fewer people are living in poverty? One way is by addressing the reproductive health needs of Pakistanis couples. Recent research from Matlab Bangladesh, which has been quoted several times this morning, has shown that reproductive health services improve the health of mothers and child, increasing their survival and also contribute to reducing the poverty. Not only are women the primary caretakers of their children and families, but they also make an important contribution to the household economy and to the national economy. In fact, by some accounts, women make up to 1/3 of the labor force in Pakistan. And the potential for their contribution would be even greater with improved reproductive health. When women can't decide how many children to have and when to have them, they are more likely to suffer from poor reproductive health, and it becomes harder for them to meet the needs of their families and earn an income. Now, women in Pakistan say they would like to have about 3 children. This is from most of the research. However, according to the total fertility rate, women are having an average of 4 children. So we are having more children than we would like. An important point here is that total fertility includes all women between the ages of 15 and 49, regardless of whether they are married or not. And this is an important point. However, when we consider only married women, the picture looks quite different. Knowing that most childbearing in Pakistan takes place within marriage, when we look at the number of children amongst only married women, we see that on average women are still having 6 children. One of the reasons couples are having so many children is because of a preference for sons. Now, Pakistan has made some progress in meeting women's desire to limit their family size, but we have not made enough, and not nearly as much as some other countries in Asia. Let's take a look at the last few decades to see what has been happening. Coming back to our graph, we are looking at a lifetime births per woman on the left, ranging from 1 child to about 8 children per woman, and we have time on the bottom. Here is Pakistan in 1965 with about 7 children per woman, and in a few seconds you will see Bangladesh coming in. So Pakistan does not make much progress until the government launches its door-to-door family planning program in 1970, and then in 1973 Bangladesh enters in green. Here in 1976, Bangladesh declares rapid population growth as the country's #1 problem. And in 1983, Bangladesh expands its community distribution program to more rural areas. Bangladesh focuses on integrating services for both population and health in the late 90s. You can see that Bangladesh is making more progress than Pakistan with fewer children per woman. When we get to the year 2008, Bangladesh is down to less than 3 children per woman, and while Pakistan has made progress, we are still at about 4 children per woman. Bangladesh is not the country that has made such progress. Let's take a look at some of other countries in Asia. Again, we have a similar setup. Here is Pakistan, and in the moments you will see Indonesia and Iran coming in. So Pakistan does not see any change until the door-to-door family planning program was launched in 1970. Indonesia enters in red in 1970, and Iran would be entering, yes, it has entered, in 1973. Indonesia has a dramatic decrease in number of children in 1970s when the National Family Planning Board begins its village-based family planning program. And then in the late 80s, Iran officially launches their family planning programs and puts it into action, making family planning services free to all married couples, and they see a dramatic decline in family size. Meanwhile, Pakistan is making progress, but not nearly as much as Indonesia or Iran. Both Indonesia and Iran continue to make steady progress, and when we get to 2008, both Iran and Indonesia are down to a little more than 2 children per woman, while Pakistan is still at 4 children per woman. But it is possible for us to make the similar progress. Why have Indonesia, Iran, and Bangladesh been able to progress further? Because the government of these countries made a political commitment and financial investments toward family planning. As couples in these countries had fewer children, they were able to slow the pace of their population growth, which meant that the governments of these countries were better prepared to provide for the needs of their population. And like them, we can continue to make progress too, but only if we make a similar commitment to improving family planning use in the country. Now, Pakistan was actually among the first countries in the region, along with India, who had a population policy and a program, which is extremely commendable. In fact, Pakistan program was viewed by many as a model. However, we have not followed through with implementation. And this is also apparent as we look at the nation's population size. Today, we have the 6th largest population in the world with more than 180 million people. If the current fertility remains constant, meaning women continue to have 4 children, by the year 2050, Pakistan would have a population of over 450 million people. The current UN projection for Pakistan's population size in 2050 is about 335 million. However, this depends on a decrease in fertility level to about 2 children per woman by 2050. So you can see that even if women start having only 2 children each, our population is still going to grow. What we have to do is to manage this growth. And in fact, one of the objectives of the new draft of population policy in Pakistan is to reduce the fertility to 3 births per woman by the year 2050, which is only 5 years from now. So it is crucial that fertility levels continue to decline because Pakistan cannot sustain a high level of population growth. The growing population means more people in need of public services. More people will need more housing, water, food, and electricity, and as well as more schools and expanded healthcare. We are already outstripping our current resources, struggling to provide for the need of today's Pakistani. The growing population puts pressure on the government's budget, crowding out other spending and investments, which could mean slower economic growth for the country. However, by managing size of our population, we can address these issues and at the same time contribute to Pakistan's development. And we can start by meeting the reproductive health need of Pakistani couple so they can plan and space their children. Currently, only 22% of married women in Pakistan or married couple in Pakistan use a modern method of family planning. And if we look at the difference, which Zeba was also alluding in the morning, between the urban and rural areas, we can see that while 30% of women in urban areas are using modern family planning, only 18% of women in rural areas are, which is about half the amount. Given that 2/3 of Pakistanis lives in rural areas, it is important that we pay attention to the rural population. In addition to these women who are using family planning, there are many more who would like to plan their families but are not using family planning. About 25%, which means 1 out of 4 Pakistani women, would either prefer to stop having children or they want to wait 2 or more years before having another child, but are not using any method of family planning. These women are considered to have an unmet need for family planning. And if we look at the unmet need amongst the different economic group, we see that about 30% of poorest women have an unmet need for family planning, and even amongst the wealthiest fifth of the population, about 20 have unmet need. One of the consequences of high unmet need is unplanned pregnancy, and in Pakistan, 1 out of 3 pregnancies is unplanned. When family planning is low and the demand for family planning is not met, we can expect high rate of unplanned pregnancy, just as we have seen. And here are some of the consequences of unplanned pregnancies. On one hand, at the national level, unplanned pregnancies can lead to higher levels of fertility, which in turn lead to continued population growth, which can restrain the country's economic development. On the other hand, at the individual level, unplanned pregnancies can lead to high-risk births and abortion, and if safe abortion is not available, which usually are not, the unsafely performed abortion takes place, which is carried out in unclean environment or by unskilled provider or both. High-risk births and unsafely performed abortion often lead to maternal injuries and deaths. At the household level, the loss of a mother means the surviving children must struggle to survive, and the cycle of poverty deepens and continues. At the national level, this loss of women means an economic loss for the country. In Pakistan, every year, this is what Population Council research has shown, nearly 900,000 abortions, most of which are unsafely performed, takes every year. These numbers are high, and they indicate that abortion is a significant means of preventing unplanned births in Pakistan. Most women who have abortion in Pakistan are aged 30 or above, and they already have 3 or more children. So the question is, why are so many couples turning to abortion instead of using family planning to prevent these unplanned pregnancies? Many couples who opted for an abortion said they didn't believe contraceptives were effective. Many felt that contraceptive had detrimental side effects. In some cases, women reported that their husbands disapproved the use of family planning methods. Another important reason was cost. Although the cost of induced abortion is high, it was a one-time expense and apparently one that couple felt more comfortable managing. All of these issues are further compounded by inadequate services. However, if we were able to meet the unmet need for family planning, we could prevent many unplanned pregnancies and abortions. So let's take a look at the impact that family planning can have. Coming back to our graph, we are now looking at number of pregnancies in Pakistan, and this time we are going to project into the future. On the left, we have number of pregnancies ranging from 5 million to almost 7 million, and on the bottom we are looking at time. In the year 2007, there were just over 5 million pregnancies. Now looking into the future, we can project that if things stay the same and women continue to have high unmet need for family planning, the number of pregnancies will increase dramatically, and when we get to the year 2015, we will have well over 6.5 million pregnancies. However, if we were able to meet the unmet need for family planning, what would happen? Now this is the blue bubble showing that what would happen to the number of pregnancies if unmet need were fulfilled. And you can see we would have far fewer pregnancies. So in the year 2015, we would have about 5.5 million pregnancy instead of over 6.5 million. That is 1 million fewer pregnancy, most of which would have been unplanned. Increased family planning use also has the potential to decrease the number of abortions by preventing unplanned pregnancy. In fact, we can see the relationship between family planning use and abortion in several countries. As the percent of women using modern contraception increases, the general abortion rate goes down. That means fewer abortions even take place. Here is Pakistan with relatively low family planning use and a relatively high rate of abortion. Now, if we could increase our family planning use, we could decrease these rates, and in addition, we could save the lives of mothers and children. When couples can time and space their children, this results in fewer high-risk pregnancy, which means mothers and children are healthier and have improved lives and survival. Thus, if we could fulfill the unmet need for family planning in Pakistan, we could prevent around 23,000 maternal deaths and close to 1.1 million child deaths by the year 2015. In addition to family planning, we can also save women's lives through abortion-related services. The current abortion law, it was a question that was asked here as well. The current abortion law in Pakistan, which was amended in 1990, states that pregnancy can be terminated if carried out in good faith during the early stages of pregnancy in order to save the life of a woman or to provide the necessary treatment. Many providers are unaware that abortions are permitted to provide necessary treatment. And most abortions in Pakistan are performed under unsafe conditions, meaning they are carried out in an unclean environment or by unskilled provider or both. Consequently, many women suffer from post-abortion complication which requires medical care. Almost 200,000 women are treated in hospitals every year for complications from unsafely performed abortions. And there are certainly many more cases that do not reach hospitals. Not only do unsafely performed abortions have an impact on women's health, but they also place a burden on the healthcare system. Data on cost to the healthcare system are limited. However, based on the cost estimate developed for Latin America and Africa, an approximate cost for treating complication from unsafely performed abortion in Pakistan would be around $22 million. This is an estimate, and the actual costs are likely much higher, since this number only takes into consideration post-abortion cases that reaches hospital, not the other health facilities are counted into it, and it does not include cost due to lost productivity from illness or death. These costs are a drain on scarce resources, which could otherwise be invested towards the country's economic development. For example, by increasing the use of family planning, we could prevent many unsafely performed abortions and reduces the cost on the healthcare system. From 2007 to 2015, the additional family planning cost for meeting the unmet need would be around $136 million, and that translates into saving that are possible because as couples have fewer children, the government does not have to spend as much money to meet the needs of the population and can save money on costs related to maternal health, education, water, sanitation, tuberculosis and immunization. And you can see we save more than we spend. In fact, by the year 2015, we would have saved 400 million, which is about 3 times the amount we would have spent to meet the unmet need for family planning. The cost saving that we gain in these 5 areas, which are all instrumental in meeting the 5 of the Millennium Development Goals, outweigh the additional cost of family planning by a factor of 3 to 1. So there is a lot possible for Pakistan's economic future, and in fact, we have seen this kind of economic progress happening in other parts of the world. Let's take a look in Indonesia, for example. Coming back to our graph, here we are looking at number of children per woman on the left axis, ranging from 1 to 7, and on the bottom we have gross national income per person ranging from $200 to $4,000. In 1975, women in Pakistan were having between 6 and 7 children with a gross national income of about $380, while women in Indonesia were having about 5 children each, and they had gross national income of about $400 per person. As we look at the trend over time, we can see that women had fewer and fewer children. The bubbles starts moving down. The country's gross national income per person are increasing as the bubbles moves to the right, and this continues to happen throughout the 1990s. And when we get to 2005, we have both made progress, but Indonesia has progressed further with between 2 and 3 children per woman and a gross national income of about $3,500 per person, while Pakistan is still at 4 children per woman and about $2,300 per person. Now, most of the world has followed a similar pattern, decreasing family sizes and increasing gross national income per person. Let's take a look. Here once again, we are looking at number of children per woman on the left axis ranging from 1 to 8, and on the bottom we have gross national income per person ranging from 0 to about $40,000. All the bubbles represent countries of the world. The size of the bubble is the population size, and the color corresponds to the world region. The red bubble are countries in East Asia and Pacific. The orange is Europe and Central Asia, clustered at the bottom right with few children per woman and high gross national income per person. The yellow is North and South America. The green is Middle East and North Africa. The light blue is South Asia, and the dark blue is Sub-Saharan Africa, clustered at the top left with many children per woman and low gross national income per person. So let's see what happens over time. As we look at the trends over time, we can see that as Women have fewer and fewer children, and the bubbles move down. Gross national income per person increases as the countries move to the right. And they are all moving towards the bottom right-hand corner. As the women have fewer children, gross national income per person goes up. Now, this relationship is not necessarily causal, and having fewer children is not the only factor that is related to economic growth, but it is one of the factors. And when we get to 2005, all the countries of the world have moved to the top left-hand corner towards the bottom right-hand corner. Although the sub-Saharan African countries have made progress, they still have many children per woman and low gross national income per person. Towards the other end of the spectrum, in the bottom right-hand corner, we have countries with fewer children per woman, and highest national income. Here is the US. All these orange countries are the Western Europe. And where is Pakistan? Here is Pakistan, and here we have Indonesia, which has made a lot of progress and is headed on the right direction. And then we have this big blue bubble, which is India, which has also made a lot of economic progress with a gross national income of $3,400 per person. But notice also the family size is down to less than 3 children per person. One of the main reasons countries like India and Indonesia have been able to make so much economic progress is because couples have started to having fewer children, and that set the stage for countries to better manage the population size. However, this kind of economic progress is not automatic. The government must make a series of investments like expanding reproductive health services, including family planning programs, so couples can plan and space their children, and expanding abortion-related services to save women's lives. Investing in health system is also important in order to improve child survival and health in general. Improving educational enrollment is key, especially girls' enrollment. Education is directly related to women's empowerment, their family planning choices, and their overall economic contribution to the country. And finally, it is crucial to stabilize the economic conditions so more jobs could be created, making sure there are economic opportunities for young women and men entering into the workforce. In order to make this kind of economic progress, we need to step up the pace of our policy and program effort. So if improvements in family planning could fulfill the unmet need of thousands of Pakistani women and help us manage our population growth, we could better meet the growing demand of Pakistani's families. And if improvements in family planning could result in millions of dollars saved for Pakistani government, then why have we not invested more heavily in family planning? Of course, there are many competing priorities, but few interventions yield the number of benefits to health and socio-economic development as family planning does. And in today's financially strapped environment, family planning is the best buy. Although we have been making progress, we can do better. How? We need to ensure that family planning and reproductive health programs, including abortion-related services, are priority intervention in provincial planning strategies and budgets. We need to strengthen budget allocation for contraceptive at all levels, especially the provincial and even district level where many decisions are made, ensuring funds are directed towards rural and poor women. We need to issue public statements supporting family planning to mobilize political and popular support. Through simple, cost-effective interventions like family planning and abortion-related services, we can have healthier women, help break the cycle of poverty among Pakistani families, and build a more stable and prosperous country. Pakistan has come a long way in its development efforts, but we are still a country that is struggling. We need the commitment of our policy makers in order to make a difference. The government is working in new health and population policies, laying out many of the issues we have just covered. However, we must ensure that policies are implemented effectively. By working together and building on a strong foundation that exists in Pakistan, we can keep the country moving forward. We can achieve Pakistan's economic and development goals and move towards a most prosperous future. Thank you.
Well, thank you very much. We're going to move on now to our third speaker of this panel. It's Moeed Yusuf, who is the South Asia advisor at the U.S. Institute of Peace, where he's responsible for managing USIP's Pakistan program. Before coming to USIP, he was a fellow at the Party Center for the Study of the Longer Range Future at Boston University, and concurrently a research fellow at the Kennedy School at Harvard. He's worked extensively on foreign policy, Pakistan's foreign policy, the U.S.-Pakistan relationship, nuclear deterrence, non-proliferation, human security, development, and South Asia. And his current research, very relevant for today, focuses on Pakistan's youth, democratic institutions, and policy options to mitigate militancy in the country.
Thank you very much, Michael. I'd like to begin by thanking you and the Woodrow Wilson Center for inviting me to speak on the issue of youth radicalization, or the prospects of youth radicalization in Pakistan. Now, I am neither a demographer nor an economist. I'm a political scientist, which basically means that I'm left with studying the political implications of what are essentially demographic and socio-economic realities. And unfortunately, these don't come out to be the most rosy more often than not. This presentation is based on my work in the past 2 to 3 years. I've been working on youth radicalization and issues relating to that. I've done a couple of papers for the Brookings Institution. I'm involved in a project on the future of Pakistan at Brookings as well, which is looking at this issue. And then also a report that I'm writing at USIP, where I'm based. And what I thought I'd do is just present to you what I see as the prospects for Pakistani youth in terms of being radicalized or not. And then I was asked to present a few policy options focusing on the United States as to what it could do, if anything, to mitigate the negative aspects of the equation. The presentation is rather long, so I'll be skipping through some parts which have already been talked about in the morning sessions. But I thought I'll just put out why the youth, why the focus on this cohort of society, and then give you the theoretical aspects which literature, the political literature on this subject says are possible indicators of radicalization in any society. We'll look at the Pakistani case, and I'll point to some policy implications. I think I don't need to mention here why youth are important in a gathering like this, but basically this threat of radicalization is being termed serious in Pakistan's case in many capitals of the world. And there seems to be an overwhelming consensus that if Pakistan's polity is to become radicalized, it's going to come about through a structural transformation in this society over the years. There's been a lot of talk about the Taliban taking over Pakistan, but if you really look at the serious analyses, those would be disregarded. And the only real danger of radicalization would probably come from this society becoming radicalized over a period of time. And the youth, of course, lie at the heart of this debate. Now, if you were to look at literature on the subject, the literature that I'm most familiar with, which is mostly political science background, there are a number of elements that are pointed out as being necessary for the youth of a country to be radicalized. These are not sufficient by any means. So just having problems on these counts does not mean that societies would become radicalized, but these are ones which are fairly good indicators of things going wrong. Alienation, deprivation, marginalization, these aspects are found in societies or in youth specifically which have become radicalized or have moved towards different forms of radicalization, although here I'm talking mostly about terrorism and militancy as we see it. But literature would tell you that youth bulge in itself is a concern, although it could be an opportunity, as it has been in many other cases. Poor or disparate educational standards, lack of or disparity in economic opportunities, something I call the expectation-reality disconnect, which I'll explain when I get to it, and a polarization within a society. And then literature would also tell you that there are established safety valves. So things can go wrong in many societies, but the state is seen as a major safety valve, as an element which can correct the course for countries who go in this direction, as well as external actors and external assistants. And I'll talk to you about the Pakistani case and how they've played out here. Let me first point out to the warning signals, which I've just mentioned are mostly socioeconomic realities. There is the issue of the youth bulge, where Pakistan, and I won't repeat this, but has one of the largest youth cohorts in terms of the total population size in the world. Its demographic transition is expected to continue well beyond 2025. It's only halfway through its transition at this phase, basically meaning that the youth will remain a major part of this society for a long time to come. I've put out a table which shows you that in terms of the percentage of total population, Pakistan's under 24 segment is about 58%, and again figures vary depending on which source you're using, but the point I want to make is that it's one of the largest in terms of the proportion of total population, and is likely to remain here for a long time. So if one is asking why worry about Pakistani youth, well, the sheer numbers would dictate that wherever the majority or a critical mass of this cohort decides to take Pakistan, it's going to end up going that way. If it wants it to be radicalized, well, that's what it's going to be. And if not, it's going to go the other way, no matter what policy options external actors like the US or even sort of internal actors dream of. In terms of the poor or disparate educational standards, Pakistan has made tremendous progress on various counts. If you were to talk to the official enclave, they would point to you, as was mentioned in the morning as well, literacy is improving. Youth literacy is higher than adult literacy, which means that they're making progress. In recent years, the progress has been higher than before. This is all true, although in absolute terms, the rates are still quite low. You'd hear about the gross enrollment rate, which is rising. The net enrollment is rising as well. The number of schools are going up, although access does remain a problem. This line coming down is actually a statistical artifact. Somebody around 1999 decided to get rid of a number of data fudging issues that were there in the data source that I saw. But basically the point is that the number is rising. Now, in terms of radicalization, if you were to talk to somebody, a political scientist, they'll tell you that yes, access is a problem. But in Pakistan's case, the real issue is the polarization of the education system. Now, Pakistan's education system is stratified along three lines. There are the religious seminaries, the madrasas, which I just want to second what Burki Sahab has said, are about the figures I've seen is even less than 2.5%. But the point to be made again is that they're not nearly as important as we've made them out to be. The private education system, which is about 30-35%, and then the public education system about 60, 62, 64, depending on which source you go by. The problem here is twofold, that the stratification is along two separate lines. One is socioeconomic stratification. The private schools to a large extent cater to the upper middle class, the elite segments of society, especially the for-profit ones in the urban areas. The public education system to the lower middle class for the most part, and the madrasas to either the extremely poor or some who are not in that category but go there by choice. The second layer of stratification is the kind of graduates they're producing in terms of their world vision, in terms of what they'd wish to get out of Pakistan. And here I've done some primary data sort of collection, but there are others like Dr. Tariq Rahman who've done work on this. And what you find is that there's a very stark difference in what the students or the graduates from these three different education systems want from the world, from themselves, and from their country. The madrasa cadres are very conservative in their outlook, narrow-minded, if you will. They're simply not prepared for the modern economy. That's the real problem. To me, the real problem is not that they're coming out and blowing themselves up. That may be a problem in a point in time, which is today. But if you're projecting forward 20 to 30 years, the real problem is that they're not productive elements of your modern economy. The public education system is also fairly conservative, less so than the madrasa cadres. But again, the problem there is the quality of education is very, very poor. So you can't really expect them to come out and produce the kind of skill set that you're looking for in a modern economy, although these things tend to change over time and are changing in Pakistan, but much slower than one would hope for. And the private education is perhaps the silver lining, at least the schools that cater to the elite and the upper middle class, where you have fairly decent quality of education and are bringing out kids who take important positions in the economy. But the real issue here is, and this is where radicalization and alienation becomes a problem, the three education systems, the students in the three education systems no longer interact or have to interact with each other. They can go through their education, they can go through their adult life without possibly having talked to any of their other counterparts in the other education systems, except if you run into them on the street, or they're kids of your house help, or etc., if you're in the elite system. So there's no real channel of communication, which is much different from the Pakistan 35 years ago, the generation before me. On the economic opportunities, again, if you were to look at figures, some of them are fairly good, although GDP growth has dropped since 2007, but the Musharraf years were fairly good, so there were positive signs there. The poverty headcount ratio, although disputed, poverty seems to have come down drastically in the past decade in Pakistan. Unemployment, absolute terms, is not very high at all, and although youth's unemployment is higher than the overall number, but the overall number stands at about 5.45% according to the latest figures, which is not too high. So there are positive trends. Now, again, going back to the radicalization, alienation, deprivation problem, as a political scientist, I would focus much more on the divisions within society than the overall macro figures that you see. And here, the inequality levels in Pakistan have risen consistently. Even under the Musharraf years, the Gini coefficient went up, not down, despite the macroeconomic growth. I don't want to get into the economic sort of debate of that. Burki Saab is the authority. But to me, the point here is, again, that the inequality figures are more important when you're talking about this alienation problem and the deprivation problem, rather than the macroeconomic figures. I would contend then, in line of what I'm talking about, that Pakistan's real problem is underemployment, not unemployment, because unemployment figures are fairly good. The public sector is no longer to absorb the surplus capacity that comes out of public education systems or the madrasas, which are low skill set, potentially low skill set employees. But even where there are opportunities, the lack of meritocracy rules out the prospects for the kids of the poor. So the prized positions always go to ones who have connections and who can actually wing it, as Burki Saab said. The private sector, on the other hand, has expanded. The service sector especially. But here, again, what they're looking for is high skill sets, well-educated, no language barriers, etc., etc. And those are again filled either by kids who come out of private schools, especially elite private schools, or are foreign educated. So who's left out? The very bulk of the Pakistani society, the 70%, 75% that's in public schools and madrasas again. So the economy is catering to a minority rather than a majority. Migration is often seen as one aspect where your youth bulge can be productively channeled. You can have surplus labor trained in different sort of capacities and levels go abroad. And then remittances, as was mentioned, become a major foreign exchange earner for countries. And here Pakistan has done fairly well, as was mentioned earlier over the years. The problem is that looking into the future, at least the projections that I've seen show a tapering off of this trend. whether it's due to the economic compulsions of countries in the Gulf. The extremist tag attached to Pakistan is a serious burden. People, especially Pakistanis who want to emigrate to the West, now have a serious security question mark. And so there is also now, of course, this reverse migration from the Gulf, which is bringing in its own dynamic in terms of this purist Islam and, you know, a different social narrative, if you will, to much of the country. So in the future, the prognosis doesn't seem, from the figures that I've seen, as positive as it has been in the past, unless, of course, Pakistan can change and train its youth to plug into different economic avenues which will be available in the world. The third dilemma, if you will, is the expectation-reality disconnect. And what I mean by this is basically to say that if you are producing kids from schools who are educated, but don't have employment opportunities for them which are requisite to their educational qualification, you are now shattering the expectations that were created when they were going through school. And in Pakistan, there's a very interesting trend. You look at surveys and you'll find that over 80% are desirous of secondary and tertiary education if they're able to find that. And over 80% also want to work, both men and women, according to some of the surveys. So there is this desire. Access to education is increasing, even if the quality is not as good. So the expectations are being raised that you've got to go to school, come out of school, and find a better living for yourselves than your parents had. If you don't have the kind of employment opportunities, if underemployment is a serious issue, if a bachelor's degree holder is going out and, you know, selling on the street, you have a serious expectation-reality disconnect, which is again something that literature points to as potentially marginalizing and alienating. And I've done a very sort of unstructured, I don't even want to call it survey, it's really anecdotal, but I've gone around Lahore, Karachi and Islamabad and talked to just people or young men and women on the streets, mostly men, who are selling, you know, just normal snacks or whatever it is. And increasingly you find that these are educated people. They're marketing things on the streets, etc., who are very disalienated, not only with the state, but with the upper crust of their own society, because they think much of the problems and much of the crowding out is a consequence of this elite capturing all the state's resources. And so you already see this trend developing. This is a busy table, but just to say that the access to education indicators are improving faster than our employment opportunities, at least to the level that students or young men and women would desire. Now, at this point, anybody can get up and say, look, these problems are there across the world. Majority of the developing world has these kind of indicators and problems. So why Pakistan and why radicalization? Why are we so bothered about this country and not others? So let me point out the political dimension of where Pakistan stands and why it becomes a more critical concern than others. The safety valves, which I mentioned in the beginning, the state and the external actors in Pakistan's case have had a negative impact rather than a positive one in terms of channeling the youth energies in the country. The Pakistani state, and I don't want to get into this again because I think this is well known in this town, but there has been a conscious Pakistani policy to support ultra-right-wing forces as foreign policy tools in the past. There's been a sort of militancy supported in India, etc. Although again the numbers were not as high, but there was a policy which then really meant that the state was exacerbating the problem rather than diluting it. And Pakistan, interestingly, is an anomaly in this case, because if you look at a number of African cases and others where you see that the state has failed to buffer the negative impacts of socioeconomic realities, you find that the states were very weak. They didn't have the capacity to actually take up the challenge and change the course. In Pakistan's case, that's not the issue. The state has been fully capable, perhaps much too strong in some cases, but it's deliberately pushed a policy of support for the ultra-right wing as a foreign policy tool as I mentioned. Islam has been used, religion has been used in a number of different ways. It's been used as a uniting factor. The extremists have been utilized as a part of military strategy. Right-wing parties have been supported over time. And the discourse, the narrative, if you pick up textbooks in Pakistan after the 80s, changed very much to become much more ultra-conservative in its outlook. And that has had an impact on the Pakistani society as well. Now, the point here is not that the Pakistani state or the military decided to radicalize Pakistan. Not at all. Actually, there was a very conscious effort to use the extremists as a policy tool, but not let the Pakistani society actually buy into this extremist rhetoric. So it was very common for the Pakistani state to come out and deny any involvement with these extremists, because the society was seen as completely separate from this policy intervention. But what that did to Pakistan, and that's where Pakistan is facing the brunt of this policy today, is that it expanded the space for the elements who perhaps have an agenda to radicalize or interest in radicalizing parts of Pakistani society to operate. The discourse became very, very, not radical, but very ultra-conservative in some ways. Perhaps the biggest danger, there is unlimited access in Pakistan now. And that's not only because of Pakistani policy, even what has happened post 9/11, but there are now militant groups operating from semi-lawless space within Pakistan, which then give access to youth who are disgruntled and deprived and alienated already. Social networks are very much present of the right wing in Pakistan. They are more organized. The secular elite and the secular political parties, and this is quite critical and often missed, have actually failed to deliver. And that has then pushed more and more youth to become alienated and perhaps find alternate means to vent their frustration. And the Islamic parties are the only ones which have any semblance of democracy within their parties, where a person like me can get up and go and join them, and not the other secular elite parties. So the only point to be made here is that Pakistan is somewhat different than other cases that you'll study in this kind of literature, because the state's policies and then what has happened post 9/11, the global agenda, has created this access to militancy and to the ultra-right wing, which many other countries don't have. Finally, what about this other kind? I've talked about socioeconomic problems, deprivation, marginalization, but you look at the 9/11 hijackers, you look at the Times Square incident, these are not people who are not educated or not well off, etc. So where are these people coming from? The first point I want to make is that this trend is not unique to Pakistan. In fact, Faisal Shahzad perhaps was the first Pakistani to be found actively involved in some element of radicalized terrorism within the US. 9/11 hijackers were not Pakistanis, etc. So this is much broader than Pakistan itself. The second point to note is that while there is now discussion of, well, we're really focusing on the poor foot soldiers, but they are not the problem, the fact is that this other kind is much less in number than those foot soldiers who are going out and doing things which we resent and sort of oppose. But here, if I were to put out, I have a hypothesis at this point, I really have to study this more, but there is an acute sense of injustice in Muslim societies as a whole against Western policies. And yes, there can be other societies that can do this, but there is a narrative in the Muslim world, the narrative of this pan-Islamic concept of the Ummah, and that Islam is in danger and the West is after the Muslim bloc as a whole. And this does play into the mindset and the narrative that is anti-West, anti-US, and sort of condemning of any real policies of the West towards the Muslim world. I put out this latest incident of the attack on the Gaza ship. It's galvanized people against the US in Pakistan, in all of South Asia, and many other parts of the Muslim world. And I think the West has underestimated the kind of impact these policies have on Muslim youth in Muslim countries. I would argue that the US policies, both in the Muslim world and in Pakistan, have created this us versus them paradigm, where the us is the Islamist narrative, which is saying, well, we are all under attack, we are all one, and the West is the other. Not to say that this has always been a fault of the US policymakers, but there's always been this narrative which has been fueled every time things like this Gaza attack or others happen. Pakistan itself has borne the brunt of much of the terrorism that has taken place in the country and in Afghanistan post 9/11. And while we may dismiss that as saying that this is a Pakistani problem, the fact of the matter is you go to the street on Pakistan and there's a very simple correlation the average person who's not educated in policy or political science would draw for you. And that would be, look, pre-9/11, I could walk on the streets of Lahore and Islamabad without thinking that I'll be blown up. Something happened on 9/11, the US intervened a month later in Afghanistan. He doesn't care whether the US had to, it was their fault, whatever it is. And look what happened to my country. So this is a very serious and strong narrative which then plays into sympathy for the ultra-right in countries like Pakistan. And I think we have to be cognizant of that. And then again, for all that we dismiss, I don't think that there is a universal commitment to this idea of strict modern nationalism in the Muslim world today. The pan-Islamic sentiment is very much there. It doesn't play out. A Pakistani would be very happy if the Afghans are off their back, but when you really talk of the Muslim cause, it does strike a chord. So what happens in Palestine will continue to impact this country and others in the Muslim world, and you will find more and more of this Times Square sort of mentality coming out if we don't focus on this problem. And so these not poor, very well-to-do, but victimized in their perception, Faisal Shehzads and others keep cropping up and then become the masterminds for these kind of 9/11s, etc., while they use the foot soldiers to create havoc in countries like Pakistan every day. So where does this leave us? I see two danger points here. None of this is to say that Pakistan this trend is irreversible or Pakistan is a lost cause. Not at all. But there are two elements of danger here. One is an internal one, where I see Pakistan becoming more and more polarized, not radicalized, not a sort of a polity that supports terrorism. In fact, surveys show quite the opposite now. But there is extreme disdain within Pakistani society for each other. The secular elite are pulling back from this entire mess. They're isolating themselves from the rest of the society, which is the bulk of the Pakistani society. The ultra-right narrative is equally entrenched and is anti-elite in its mindset. And the centrists, which is really the moderate, culturally conservative, progressive Pakistan, which to me is about 85 to 90% of the Pakistani society, is increasingly squeezed for space and is being pushed to either choose one or the other side. And this is dangerous because ultimately one doesn't know which side they'll fall, because they also harbor this anti-elite, anti-Western attitude that the rest of society does. The second danger point in the external dimension, I've already mentioned this, so I won't belabor the point, but there is something that the West has to look at, because there's a direct impact of US and other policies on feelings in the Muslim world, especially in Pakistan, because the US is a force physically present next door and having much to do with what is happening in Pakistan, good or bad. But the more people can see the US and associate itself, associated with heavy-handedness, where things go wrong, terrorism, again, the point is not whether the US ought to be blamed or not. It's the perception. And the perception is very clearly that the US ought to be blamed. And that's where the problem lies, whether it's PR campaigns, etc. But the more that happens, the more this anti-Western mindset will galvanize Pakistanis to unconstructive endeavors. Just skip that, but these were just pictures to show you that Pakistan is actually, the real problem is a polarization of the society, not necessarily that the society is moving right and it's going to be a Talibanized country at any point. Danger is not imminent, because the problems that I've pointed to are all artificially created. The socioeconomic realities have been talked before. There is a correction course which is in place. The policy to support the militants, Pakistan military has reviewed it. It's going to be a very slow, agonizing process. But I think at a conceptual level, there is a clear understanding that this policy has outlived its utility. And the external actors, I think, more and more have to realize that the way Pakistan is being dealt with is probably counterproductive, if anything. Let me just quickly take a couple of minutes to point out, I won't go through all of them, but just to suggest where the US role comes in. This is not to say that the US is the only actor or even the principal actor who has to change Pakistan, but there are a number of things that have to be done. Quality of education is one. I've put down some specific sort of suggestions as well, which you can perhaps skim through. But on the last point of the madrasas, I just want to say this, that the entire policy focus in this town in the past 8 years, or a lot of it at least, has been on this demon, the madrasa, the seminary, producing the terrorists, etc. And we've completely missed the boat, because we're talking of 2% of the Pakistanis over and over and over again. And if you really want to project forward, it's the public education system you have to do something about. So whatever can be done on that is much more critical than this sort of short-term, frankly myopic view of focusing on the seminaries. Economic opportunities, Burki Saab mentioned an inclusionary economic model, people-centric. I think that's already very much on the cards being talked about. It's in the 5-year plan. It's in the report that you've done, I believe. So that of course is there. And the others, of course, which are long-term propositions, meritocracy, better governance, etc. Want to stress again on this element of migration, because I think this, in the next 5 to 10 to 15 years, as the other correction course bears fruit over the medium term, is the single most critical factor if Pakistan has to do something with its youth constructively. And here I think US policy remains absolutely critical, and other Western countries, to allow more Pakistanis to actually come, to be educated, to actually work, or whatever. But if that is not done, I don't think Pakistan has the capacity at this point to deal with the kind of numbers it has to be employed and to find other means of livelihood. The state I've already mentioned. I think there is a review at the conceptual level. Pakistan is moving away from this policy of using militancy as a foreign policy tool. But again, this is going to be very slow and agonizing process. The India question, although, will remain important. And until that, the issues like Kashmir and other outstanding disputes are resolved, I'm not sure that you can get away from this militancy business completely, even if they are not supported by the state. The US approach to Pakistan, ultimately there are 2 points here in these bullets. One is that Pakistanis need to be convinced that the US-Pakistan relationship has some permanence this time round. And there's been a tremendous effort on part of Washington and Islamabad to do that. But at this point, I may be exaggerating, I haven't found a single Pakistani who believes that the US is going to stay there a day after they pull out from Afghanistan. I don't know how to change this. I've been working on this a lot. I'm as frustrated, but there is a need to focus on this. Perhaps one has to remove the opacity with which this relationship is working on the track 1 level, where the people are getting a completely different message and sense than what is actually happening in the relationship. And then, of course, the cultural sensitivity to what the US is doing in Pakistan remains critical and will remain critical, whether we like it or not. And of course, there is this broader question of the Muslim world as well, which does feed into what happens in Pakistan and other countries. To end, I think the warning signs and the exacerbating factors are very much present in the Pakistani case, but that is not to say at all that the country is beyond repair. In fact, ultimately, I, after having said all this, am an eternal optimist, and I see positive signs where the next 10 to 15 years are to be taken as a corrective phase. You've got to institute policies which will bear fruit in the medium term, not in the short term, and then the longer term future may well be brighter for Pakistan than it is. Pakistan has to take the leading role. I think there is this sense in Pakistan and somewhat in Washington as well that we sitting here can change Pakistan. It can't happen. Actually, after some point, the involvement is counterproductive. Pakistan has to take the lead, but of course, the US remains potentially a part of the problem or the solution, depending on how these policies work out. Thank you very much.
Thank you very much. And just to note that we'll be revisiting youth issues in Pakistan this afternoon when we hear from the British Council. So that's to keep in mind. You'll get another perspective. Let me ask a question, and I don't want to be a cynic, but I will anyway, just for a minute. We've heard much talk this morning about various things: expanding reproductive health, increasing educational enrollment for children, improving educational opportunities and employment opportunities, particularly for women. And this will require a lot of things. Now, one of these things is money, and the Pakistani economy is weak. And given what seem to be current budget priorities, defense, debt repayment, public administration costs, things like that, my question is, where will the money in Pakistan come from? Setting aside for a second the issue of the international donor community or the U.S., it seems to me that there'll need to be some sort of shift in budgetary priorities. So the question is this realistic? And I know we'll be hearing from the Planning Commission during lunch. I'm sure those will be addressed, but I'm curious to get your perspectives.
Does this work? I think you're raising a very important question, which is that this is a resource-stressed economy, and it needs a lot of additional flows in order to do some of the things that we have been suggesting. There will be a period of transition during which the international community will have to play a role. I was in Islamabad last week, or is it earlier this week? And I talked to the people over there who were preparing the budget. There is a great deal of frustration on the part of people who are managing the resource situation, that the United States has been extremely slow in dispersing resources. $1.5 billion a year that was promised under Kerry Lugar has not arrived. There is an urgency attached to this which, for some reason, Western capitals have not recognized. My own view is that we need an extremely well thought out plan which covers some of these areas. Pakistan itself has very few resources, especially if it is being asked to commit much more on the military side and counter-terrorism and so on. I have made this proposal several times before, which is develop a 5-year plan and let the donor community front-load the program with faster dispersing assistance, but make sure that the back end of the program is fully funded by Pakistan, and it should begin to prepare for those kinds of things. There is a desire in the country to take a careful look at the expenditure side, non-development expenditure, which is quite large. We talked a bit this morning about the 18th Amendment, which transfers a lot of functions from the federal government to the provincial government. So there is the need to rationalize the government structure in the federal government and begin to save some resources. So all this will require the donors and the Pakistanis sitting down and agreeing on what kind of flows will be made available, how fast they will go, and for what all this money will be used. And my sense is that since Kerry Lugar, which is now almost a year old, very little of this has been done. So action is needed from both Washington as well as Islamabad.
Could I just add to this again, because I look at things in a political framework. I've heard a lot about this. I mean, Kerry Lugar, from what I was told, 16 million has probably moved since we sort of started this. The point is simply this. I think Pakistan will be fooling itself if it's hoping for this kind of aid to come in and do something. And the reason for that is, to me, is fairly simple. I mean, you just look at the trends. And Pakistan has not received the kind of... I mean, the perception of Pakistan in much of the world remains extremely negative, even though Pakistan feels that it has done much more than any other country and has borne the brunt. And these decisions are, to some extent, politically motivated. I mean, at the height of Pakistani problems, war on terror, Pakistan is needed. What did the Friends of Pakistan deliver? They sent Pakistan to the IMF. That's what they did. So if you're really serious about getting a country out of trouble, the trends to me are not positive. If I were to project pessimistically in the future, I think the Kerry-Lugar bill has one major problem, which is that every 6 months the Secretary of State has to go and testify to say where the money has been spent. Now the fact of the matter is neither the US nor Pakistan has the capacity to efficiently spend and track this money. So in the third monitoring report, when things are not going well in Afghanistan and where Pakistan has not spent the money, the Congress will get up and say, why are we throwing this money at this country? That's already happened. So I think Pakistan has to really understand and be realistic that this aid that we've talked about so much is not going to be as easy to get and then spend. Let me just say that if I were to look at a 30-year, 20-year time horizon, aid is not the issue in any case. The transitionary phase it is. But there are two major structural problems with Pakistan's economy. And I don't want to remotely sort of pretend to be an economist. But the tax to GDP ratio is stuck at 9% for the past 10, 12 years. And the saving rate is abysmal. Now, if Pakistan has to do something and to get rid of this begging bowl, which our leaders come to Washington and other capitals every year with, those are the aspects to be worked on. And at least the budget and the 5-year plan are very explicit in saying that we need to change it. Now, the sad part is that 15 years ago, the 5-year plan said exactly that. And we're still sitting there. So I don't know whether that will happen. But I think let's not exaggerate the role of aid or the ease with which Pakistan can get this money and spend it.
Okay, show of hands, and I ask that you keep your questions brief and identify yourself. So let's start with the woman right here in the black.
Hello, I'm Sarah Clark. I'm at the Futures Group, and I'm a longtime friend of Pakistan. And I guess I wanted to ask the two non-demographers a question real quick. First, for Professor Burki, that what did you don't mention anything about family planning as a possibility for any, and I've noticed this to be the case often with economists. They're happy to just study it, and they're happy to talk about moving populations around and so forth, but the one policy lever that we know can actually affect it, I don't think you touched on that. And then similarly to you, is this something that you could do like further back than getting jobs, but is it something that could be useful, further down the chain? Thank you.
I did talk about family planning. I presented one of my what-ifs scenarios, and I said if the program that Ayub Khan had put together and was implementing very vigorously, if it had been pursued, then it would have resulted in 30 million fewer people in Pakistan today. I take family planning as given, and I thought Zeba had said enough about this for me not to repeat it. My point was that it is extremely important in order to plan for Pakistan's future to factor in various demographic aspects. What are the burdens? What are the opportunities? How can we deal with the burdens, and how can we realize the opportunities? And then what is it that the foreigners who are engaged with Pakistan can help? So that was more or less what I was trying to do. But family planning is given. And as I said, in the case of Bangladesh, for instance, it was not aggressive pursuit of family planning by the government, which really turned out to be the main contributor to change, but the fact that the demand increased and people asked for it, and a lot of it was supplied through commercial channels rather than government programs. It was the engagement of women in the economy of the country and very high levels of employment of women, and so that became the catalytic for change. You create demand, supply will appear.
Yes, you're right. I didn't mention family planning, but only because I think it's a given. I don't see any reason why, we just can't get away from that. And that is, and if you look at the actual couple of papers that I've written, it's very much there. That said, I think part of the premise of what I said was that in the next 10 to 15 years, there is a population number that is also a given, right? So you've got to work on that, but that issue is there, and so you've got to deal with what you have at hand at the moment.
Michael, I just want to, I think in terms of since there was a huge focus on the youth and taking on Sarah's question, but it is really important that we talk about the sexual and reproductive health of the young people from a very young age, and this is something that's a huge focus in Pakistan. So whether it is a political scientist who is talking about it or an economist, we feel that it is extremely important that it is weaved in, because we have seen that absence and we have seen that complete loss of focus, because the way our population program has suffered, because it was never been looked at by the finance and planning with the same kind of an importance. So yes, it is extremely important that they hear this message from the horse's mouth, because when we talk about, okay, they are reproductive health activists, they will always talk about it. So it's an extremely important message that all of you who are so important and who can impact the policies should be talking about it in a much more bolder statements to make that heard.
Okay, right here.
Larry Robinson, former diplomat in Islamabad. Two very quick and I hope provocative points. One on aid, why it's so disappointing, why it's so slow. Track record in Pakistan is that you can either give aid through the government, in which case 90% is siphoned off before 10% is actually does good on the ground with very little to no accountability, or you can go through AID-style programmatic functions where you have tremendous accountability with a corporation and a whole lot of NGOs, and eventually 10% is spent on the ground and 90% goes to administrative costs and security. Neither works. The two most effective aid programs I know of in Pakistan were the immediate transfer of cash after 9/11 direct to the government, and the Coalition Support Fund, both of which are now considered abysmal and completely off the table. Second point, relating to both your points are about the access to American universities for Pakistani students, and also Moeed Yusuf's very good points about the polarization of education in Pakistan. Moeed, you touched on it, but language is key. People go to private schools in large part because they're English medium. If you want the opportunities in the modern sector in Pakistan, you have to be fluent in English. Nobody coming out of Pakistani public school is fluent in English. Until you start fixing that problem, it's not going to work. Thanks.
Okay. We're going to go right to the back. I think that's Bill Milan back there. And then we'll take a few questions on the other side of the room.
It is I, you're right. And I probably shouldn't be asking questions because I'll have a chance later on when I'm up where you are, Michael. But I have a little different take in the comparison with Bangladesh and Pakistan on family planning and on population trends. You've mentioned, I think you mentioned, Mr. Burki, the development of women, the education development of women as the primary factor. I agree with that. And the early speaker, whom I didn't hear, evidently mentioned family planning or something else. But there is a difference. There was a difference in my perspective between the role of the two governments. In Bangladesh, whether effective or not, the government was actually supportive of family planning and tried to be facilitative most of the time. Governance is not the strongest quality in Bangladesh, so government wasn't very effective, but it sort of let the private entities, NGOs and so forth, do their thing, and the donors too. And their thing turned out to be, in part, family planning. This, of course, helped what was already going on with in the development of women. And so I think when I was in Pakistan, I didn't ever have the feeling that the government was really supportive or facilitative of family planning programs. So my question, and that is really to Ms. Qazi, has that changed or am I wrong? And the second question is really to Moeed about education and the radicalization of the youth. First of all, I wonder if any of you have a sort of ballpark figure for what it would take over the next decade to repair the public education part of Pakistan's education system. It would take a lot of money, I presume. And secondly, what was my question?
We could stick with the ones you asked if you want.
No. I'm not finished yet. Isn't also the curriculum in the public education system a serious problem in terms of this narrative you talk about, which I have a great interest in too? And I wonder if you don't need to work on both. Thank you.
So I go first? I think I raised in one of my slides the similar comparison which you are just stating, that why at the same time when both countries had a program, the difference was there, and you have rightly stated that, but I would like to unpack the qualifiers that you have used, the role of a supporter and a facilitator. I think none of the governments in Pakistan has been anti-family planning. So if you say support in that term, they have always been supportive. We have always had a policy. But if you really qualitatively look at that support as a facilitator role, as giving in terms of giving the right budgetary allocations, giving the right systems allocated to it, have the right support from the other ministries which are supposed to work for it, has been absent. And that has been the biggest advocacy call for us. Things have been changing in Pakistan lately. In the last decades, things have started moving towards realization of the fact that you have to give serious attention to it. But the realization is out, it becomes constrained when you have this low budgets, competing priorities, and all those factors. But I think the question that was asked earlier when Zeba was talking, that this is the first time that the Ministry of Health in their policy, which has just been approved, has put family planning in all its tiers, especially in the basic health unit. And this is a major shift. If it really happens, in Pakistan, policies are not an issue. We have inherited from a colonial era. We are best in writing policy. If you look at our policy, they are beautiful documents. We are very bad in implementation because that needs political commitment. And that is what we are trying to achieve. So our latest health policy has shown a remarkable shift in that sense, that the first time they're embracing family planning in the sense, and as I say that I see the champion of our Ministry of Health entering in, Dr. Juma. Dr. Juma, thanks for being here. So this is the first time we are seeing that change happening in Ministry of Health, and we feel that this is the time and this is the opportunity. It is unfortunate that when this change is happening, we are also having this scarce resources and very slow kind of budget releases and all this stuff happening, very huge commodity security issue. So how do you keep on doing that? But definitely government is trying its best to be a facilitator. It needs a lot of support. It needs various other things to happen, and I think the private sector, the NGOs, and all of us are trying to do that.
No, I completely agree with you on the curriculum and the narrative. In fact, when I mentioned that the students coming out of these three education systems have very different worldviews, that's where it's coming from. I think there is a bit of an exaggeration when we talk about this element of pro-jihad and that kind of, it's not out there to promote jihad and violence, but it certainly is, there is a lot to be rectified in terms of what they're creating for these students to look at the world as and what they could do as productive members of society.
Regretfully, we're only going to have time.
Let me just make one comment about what Bill was saying. Mine is the bias of an economist, and my belief is that if you empower women, either through employment or through education, and demand for contraception and family planning material goes up because of that, the private sector itself will find a way of delivering that. And if the private sector is finding it difficult, then the state could provide certain amount of subsidies. But to force contraception through people's throats, no, that's not right. You don't force contraception through throats. But you know what I mean. I mean, I don't think that really works. I think what works is create demand for it, and demand for it will happen if women have jobs, if they have independent incomes, and if they can take decisions independent of their husbands.
All right, one more question. It's going to be the gentleman sitting on the aisle. 1, 2, 3, 4, 5, 6 rows up. Yes.
Thank you. My name is Obaidur Rab. I'm Country Director of Population Council, Dhaka, Bangladesh. I totally disagree with Dr. Burki. The things you are talking now is 30 years old economic theory. I can argue on this thing. We have proved that with the public sector service delivery system, within a span of 15 years, you can reduce your fertility from 6 to 3.5. And it happened. For information, 85% of the family planning services in Bangladesh is being provided by the public sector, not private sector, not commercial sector. And Ambassador Millam here, he has mentioned you this thing. Whole this economic theory of a microcredit and other thing has not any impact on contraceptive use in Bangladesh. We have did both case control studies, comparative studies, we have not found anything. It is the only one factor which has proved to be most effective is the organized family planning program in the sector. The country has reached replacement level fertility in half of the country where economic activities is comparatively low than the Dhaka city. If you think about the whole government sector which is working in Dhaka city, fertility is still above 3. But the southern part of the country which has reached replacement level fertility less than 2 is no employment. It is the creation of the demand, as you mentioned, by the public sector on giving information and education which led to increased contraceptive use. Second question.
Actually, why don't you just keep the first question? We need to wrap up.
Okay, so when I have a related to madrasa thing, just for clarification. Mr. Moeed, madrasa education is divided again into 2 parts. The secular madrasa and religious madrasa. You have to be distinguished, otherwise it will be very hard for us to distinguish which madrasa are you talking. The secular madrasa, which is a regular madrasa. And you are the religious madrasas, which are Hafizi madrasa, where we teach people on Quran. So it is the religious madrasas which are giving us problem, not the secular madrasas.
So, Michael, can I just say one thing, Burki Saab, when you were saying don't push the contraceptive on the throat. So how weak and how bad our population programs have been, and we have not been able to achieve more than 30% CPR. The one good thing about Pakistan population policy is that it has never been coercive. There has never been a coercion, and it has always been on the clients. And this is the credit you have to give to our, population program.
Just to clarify on the Pakistani count, when I mentioned madrasa, and I think others as well, we were really talking about the religious madrasas. They teach other subjects as well, but there is a focus on Islamic education.
Well, I know we could go on, but someone must be hungry. So let me explain what's going to happen for the rest of the day. We're going to go to the 5th floor, 1 floor down, where lunch will be served. Though, please allow our luncheon speaker, Saba Gul Khattak, along with Bill Milam, the chair, to serve themselves first so that they can have time to get their food. And then we will start at 1 p.m. with the luncheon address. Thank you.